project, we hope to be able to develop strategies and book for education and awareness about our screening programs to try and encourage more people to participate in the program. The needs vary. We're not huge geographically compared to other provinces, but in spite of that, although access to services should not be a challenge given our geography, we recognize that some people do not access the services that are available. We have the capacity to do geospatial mapping, and we were able to pinpoint participation by postal codes. And using that, we thought we will try and determine where the areas of poorer participation were, and then try and develop strategies to maybe educate that particular population or increase awareness, etc. But again, by linking up with other databases, we're able to sort of determine whether that population is defined as urban or rural or semi-rural, and what the income quintile would be and what the education level would be.
I consulted, for example, the Department of Health, the primary care, and find out which community health centers were associated with the areas that were least participating. In that sense, we were wanting to know what services they were provided and to whom, and whether they would be interested in having more information from the New Brunswick Cancer Network, and if they were aware of all the tools we were able to give them in order to promote cancer screening in their communities. So we surveyed them at first, and it was a survey that was a mix of multiple choice and open-ended questions, so we could learn more about what they thought were the reasons why their population was not participating as much. Therefore, we were able to provide them with information to start with, find out some information from their point of view, and then look at what were the perceived barriers and enablers to cancer screening. And the reason we did that was that we wanted to go there first to find out if their perception were the same as the public. For the public surveys, we wanted to know what their reasons for not being screened, what not going for screening, cancer screening was. And the second question was really what would help them better understand the importance of cancer screening. The communities were telling us themselves what would work and whether or not, which best way it would be to get us back the information we were looking for. We ordered a lot of reusable bags because we thought we would be able to use them for many years. And these bags were, had the information on it about the toll-free number, for example, the Screening Saves Lives logo. And it also had our website. So it was a way of reaching out and promoting. At the time, it was something that in the communities I knew, they were using it for food banks and for bulk buying food programs. As soon as people started to know about this approach, then it was easy to approach the communities and say, do you have a food bank in your area? And then would they be interested in distributing those bags while we can distribute our surveys and get the responses back through the mail. But it was up to the community contacts who would then take on those bags and distribute them in areas of their community where JSDAs or bingos or the fresh fruit program the food banks would be located, and this is how it would happen. Really, our role was to provide the material, the information, the bags, and then it was up to the community to make the best use of those bags and to spread the word the best way they thought was appropriate for them under the circumstances. As soon as I spoke about, getting some information through the food banks, it seemed to just, they really liked this approach. And so I was given really good contact people, names and what their roles were into the First Nations communities. And really in no time at all, at their request, I was able to distribute, I think it's 600 bags in 5 of the 6 communities. And that's important to understand, that even what works in one First Nations community does not necessarily work in another. When we were allowed to go, that the restrictions were lifted enough so that we were able to host a booth at a powwow, we were able to share some of these findings with the community members. And the contact was there with us the whole time. And we were able to set up a nice area. And in the most, she knew exactly where to be in order to have the most traffic. And people stopped, all ages, all females, males, and would say, oh, yes, I got that letter in the mail. And where can I sign up? We were able then to be doing some interventions at the community level, but we also were able to meet and really connect with the elders in the community and talk about, okay, what is this community really needing? And then for them, it was important that we'd host a workshop. And they were recommending that it would be a face-to-face workshop, in where part of it was not only just cancer screening, but part of it, cancer screening, would be in it. And then we'd have a real group discussion on what would be the next steps. And we would have to also have more information about what they perceived as their barriers. If it was fear, was it fear of the test itself? Was it fear of the results of the test? It was pretty clear that in every low participating areas, whether they were First Nations or Anglophones or Francophones, fear was the number one barrier for people to participate. And then the number 2 was lack of information. And then lack of information was like, it was as if they needed to hear it. Like the enabler for them was they wanted to have community members talk about maybe somebody who had an experience and was able to tell of how easy the test was made, or how to go about it, or having a bit of a show and tell, much more than having a letter. The number 1 enabler, and in almost all general and low participating, an explanation from any healthcare worker, not necessarily a primary care provider, nurse practitioner, or a physician, but anybody. It could be an LPN, it could be a dietitian, it could be a social worker, any healthcare professional could give them the explanation about what the cancer screening test was, especially for the colon, was the number 1 enabler. And in some areas, it showed that, a toll-free number is great for the general population if they want to ask some question when they get their invitations. But for the low participating, they don't reach out. They prefer to have Facebook ads. They prefer to have newsletters. information in their community newsletters. It came out over and over, but this does not really work well into urban areas. So in the big cities, that's not how to best, communicate with them. So it varies, but luckily at NBCN, we do various ways of, reaching out to them. So the Facebook ads are there already. And what we can possibly do is enhance our website to offer, to put in information about the cancer screening programs in their newsletters if they ask to have, this done. So this was things that we were able to learn along with the surveys responses.
We are the New Brunswick Cancer Network. We oversee cancer programs in the province. And the way we do this is by working with our partners and developing networks. And I think, to me, that's probably underlines the importance of what we've been doing all along, is the networking aspect and working with our colleagues rather than being prescriptive, work with them and change our strategies and change our contributions to suit their needs, listening to what they have to say.
Once you provide the information and let them what the goal is, then let the community, the trusted members of the champions, take the lead on discussions about ways that would work for them. Because what works in one community may not work in another community. The relationships have been built, and I think this will continue a good relationship with NBCN.